dyskinesia,
hallucinations,
freezing, the cognitive issues,
they're switched off,
rigidity,
it's difficult to swallow,
loss of confidence,
confused,
low blood pressure,
can't move, can't speak,
depression,
the constipation,
apathy.
Changed my personality.
The symptoms and progression of Parkinson's disease is very unique to each individual patient. They experience their disease in a very different way, and it can take us as healthcare professionals, along with the patient, a long time to establish the best individualised medication regime for that patient. As their disease progresses, we find that we are adding in doses at particular times to treat particular symptoms like wearing off and freezing and even nighttime problems. So the patient can end up on a medication regime where they're taking medication doses up to 10 times a day through the day and even through the night at times.
and Parkinson's is so diverse, or everybody with Parkinson is a little bit different to everybody else, and it does actually complicate things a bit.
People with Parkinson's disease, we use the terminology switched on and switched off. It's not that's not a symptom of the actual disease. It's usually the medication that they switch on and switch off. On is where they're very independent, they can wash themselves, feed themselves, dress themselves, be articulate, join in, be really social people. And switched off is where they actually need feeding and they need dressing.
If I'm going off, it's like somebody taking a plug out of a bowl of water. You can feel your energy going down the plug hole and you just fade into nothing. Or the other way I can go off is to have terrible cramps. They start in my legs and work up my body. So it affects my whole body and I can't speak and I can't feed myself or anything.
We realise that when people with Parkinson's disease are admitted to our ward, they've very often got their own scheduled medication from what they take at home, and it's very often not at a time of day that people normally take the rest of the medications on the ward rounds, and it's quite frequent compared to other people's medicines, and it's very important for them to carry on the same routine that they carry on at home so that they don't lose the benefits of the medication, which can delay the care when they're in hospital and end up delaying the discharge.
The tablets perform better by taking them on time, so 8 o'clock, 11 o'clock, 2 o'clock, 5 o'clock, 8 o'clock. And if you do that at a strict routine, they work better and you get much better feeling from them.
The nurse would come up and say, "I'm sorry, Mrs. Bancroft, there are other ill people in this ward and you'll just have to wait your turn." And of course with Parkinson's you can't wait.
With Parkinson's disease, medication regime is interrupted or disrupted by their admission to hospital, and that means even just missing 1 or 2 doses of their medication. It can take hours, days or even weeks for that person to stabilise and get back to their position prior to their admission to hospital. This video illustrates the importance of patients getting their Parkinson's medication on time. This lady's missed 2 or 3 doses of her medication in the morning, and it's caused her to have problems getting up out of her chair. She's got difficulty with her walking, she's got gait initiation problems and freezing. This lady would struggle to go to the toilet by herself. She'd need to call a nurse to take her to the toilet. She wouldn't be independent in her bed area. She'd need help for somebody to come and get things out of her locker for her. She'd need a lot more care than she would have done if she hadn't missed those doses of medication. This now shows the same lady when she's on her normal medication regime, and as you can see, she's freely able to get up out of her chair without problems. She's able to walk to the end of her bed. She is a little unsteady, so she would need a walking aid to help her get to the toilet, but she would be able to do this independently. She wouldn't need to call a nurse to help her get to the toilet or to get anything out of her locker. She'd be independent and able to care for herself.
Time, as we all know, is a precious commodity, and with the nursing staff it's utmost. I understood fully why they couldn't give me the time that I needed, even for simple things. And when it came to medication, some of them were cooperative, and others it was just too much on what extra of what on what top of what they were doing for me. Then you would get somebody on the other hand who would set a stopwatch on a mobile, and when it went off, she knew it was time for me.
As the disease progresses, patients enter into a complex phase of the disease, which can be a very fluctuating time for the patients. And they can find that they're on multiple medications frequently through the day and also at night. They can also be on medications to treat the side effects of the Parkinson's disease medication. And at these times, the timings of the medication and patients sticking to their individualised timings of their medication can be vital in effectively controlling the disease and the symptoms for that person. Okay, this is a typical hospital drug card on the wards, and as you can see, the options for prescribing medication there are 4 times a day. This is a typical Parkinson's disease patient's complex medication regime where they're taking their medication 9 times a day, and this doesn't easily fit into the 4 times a day medication regime. So it's really vital that the doctor that's admitting this patient takes a full drug history from that patient, including the timings that they take their medication, and adapts the medication card to prescribe the medication exactly as the patient's taking it while they're at home, so that can continue while they're in hospital.
But the Get It On Time campaign reminds us every day on ward level that Parkinson's patients have special needs in terms of getting their medicine. It might be at different times to traditional drug rounds, and we need to make sure that we adapt our service to make sure that they have their medicines as they would normally at home.
And one nurse forgot to give me my 8 o'clock medication. By 10 o'clock I was beginning to feel an absolute wreck with the pain. I couldn't breathe. And I said to him, I haven't had my 8 o'clock tablets, have I? Oh no, he said, I haven't. Never mind, I've given them you all. And he lumped my 8 o'clocks together with the 10 o'clock medication. And you can imagine what that did to me. I was violently sick, on high dependency. And that was just through not understanding that if you miss a medication time, you cannot double up later on to catch up. It's not a catch-up situation, it's giving them on time.
And to help with this, we have got the timer which we can set, which will then alert us that they need the medicines so we can come and give them to them.
I told them I was taking Parkinson's tablets. They said you'll have to keep those. And I was amazed because I thought they would have taken them off me, and that's what I was worried about. The fact that they were happy to take them, to allow me to have them, took a lot of weight off my shoulders.
If at all possible, we assess people anyway for self-medication routinely as on admission to the ward. If at all possible, we allow people to give themselves their own medicines, because then they're getting them as it suits them. They don't have to wait till we look as if we're free and get embarrassed and end up waiting longer than they used to.
Self-administration of medicines is very important for us to be able to offer to patients. We expect patients to manage their own medications at home, and when we come into hospital, especially if they're well controlled with one of their disease states, it makes sense that we help them to retain their own autonomy over their medicines and continue to manage their medicines. It's better for the ward staff because the patients can manage their medicines correctly, and we have new lockers with individual patient keys so that patients can access their own medicines while keeping them safe on the ward. And it's basically going to help also with discharge planning, so patients who need assistance to get used to taking new medicines have the support of doing it on the ward themselves before they're discharged and expected to manage their own medicines at home.
And they should consider the fact that if they take the tablets away from the people, it increases the amount of work they will need to do. It'll increase the amount of times they'll have to pass tablets out, because everybody has a different regime, and the hospital regime doesn't fit in. And the patient knows what they require, have taken them for many years, and know what they need, so why don't they leave it with them?
If you do get it on time, it releases the staff to carry on other duties which obviously are necessary duties, and also it gives the patient, in this case Rosemary, far better quality of life while she's in hospital.
She never walked for 3 months, you see, and I think one of the doctors pointed out that if you don't walk on your feet, and if you've got Parkinson's as well, your feet actually move.
Forget that they're seized. Your brain doesn't get a message, so I said I've got to try and keep something. If you see which feet how bent they are.
Although I don't blame any nurses for what has happened to Judy, I really think that the more we can tell them how important it is. I mean, the timing is absolutely imperative with Parkinson's.
I understand that staff haven't got the time, but me sitting in a bed, absolutely crunched up with cramp, in such pain I can't explain. Not being able to talk and tell people that you need an injection, and people quite rightly saying, I'm not giving it to you because I don't understand, I haven't given it before. But I've only got one feeling then, give me my apomorphine.
I mean, really, if Judy had had a medication on time in hospital, she wouldn't be sitting in this chair.
The staff were marvellous. When they all came round to the feeling and they'd seen me in such an off, and then they could help in turning me back on by being on time, just a few minutes mean a whole world of difference to somebody with Parkinson's.